Hola, ¿qué tal? Buenos días. Buenos días a todos y todas. Bienvenidos a esta
Hello, good
sesión.
morning. Welcome everyone to this virtual session, which is a press briefing. I am Sebastián Oliel, PAHO Communications Department, and today we're going to give you an update about the situation of measles in the region of the Americas, and we will present some recommendations from the regional committee on monitoring and re-verification of elimination of measles, rubella, and congenital rubella syndrome. I am here with Dr. Jarbas Barbosa, Director of PAHO, the Assistant Director, Dr. Rhonda Seeley Thomas, and Dr. Daniel Salas, who is the manager of the immunization program. You will be able to ask questions using the Q&A button, or also live if you want to ask your question directly. We also have some questions we've already received. We would ask you to please say who you are, give your name and the newspaper or other medium that you represent, and we have interpretation in English, French, Spanish, and Portuguese. Over to Dr. Barbosa.
Thank you, Sebastian. Thank you for joining this press briefing. Good morning. Last week, PAHO's Measles, Rubella, and Congenital Rubella Syndrome Elimination Regional Monitoring and Re-Verification Commission met to review the most recent epidemiological situation in countries of the region of the Americas. The Commission concluded and made a recommendation that I accepted, that the endemic transmission of measles has been reestablished in Canada. This commission, they use a very objective criteria. If a country shows a sustained transmission for more than 12 months, it's considered that it has been reestablished, the transmission of measles. So after reviewing all the epidemiological data from Canada, this commission recommended that the reality is that Canada lost its verification as free from endemic measles transmission. And when we have one country in the region that lost this condition, the region as a whole also loses this condition. But it's important to say that all the other 34 countries in the region, they keep their certificate as measles free. So we have at this moment Canada, that was unfortunately, after reviewing very carefully the epidemiological data, the Commission made the recommendation about Canada. And of course, if you have one country in the region of the America that is not certified, the region also lost this condition. This loss represents a setback, of course, but it is also reversible. Until measles is eliminated worldwide, our region will continue to face the risk of reintroduction and spread of the virus among unvaccinated or under-vaccinated populations. And the reality is that in all the other regions in the world, at this moment, we have several outbreaks of measles, so the countries in the region of the Americas are receiving almost every day or every week imported cases of measles from other regions. However, as we have demonstrated before, with political commitment, regional cooperation, and sustained vaccination, the region can once again interrupt the transmission and reclaim this collective achievement. Measles is the most contagious virus known to humankind. One infected person can transmit the disease to up to 18 others. Thanks to vaccines, many people have never seen an outbreak in their lifetime, but measles can cause severe complications such as blindness, pneumonia, encephalitis, and even death. In some young children, the virus can remain dormant and cause a nearly always fatal encephalitis years later. Outbreaks also disrupt daily life. They interrupt schooling, work, and community activities, and increase healthcare and hospitalization costs. Stopping the spread of measles requires that at least 95% of the population be vaccinated with 2 doses. This is very important across all communities without exception. At present, Belize, Bolivia, Brazil, Mexico, Paraguay, and the United States are also facing active outbreaks, most of them triggered by imported cases. However, not all countries are experiencing sustained transmission, and we will have time to prevent it. Despite the great efforts made by the government, health authorities, and health workers of Canada, the country has lost its measles elimination status and is now considered endemic for this disease, as it has maintained the circulation of the measles virus for 12 months. Nevertheless, the country continues to make significant efforts to control its current outbreak and remains firmly committed to achieving elimination again. PAHO has been and continues to provide technical cooperation to countries to strengthen surveillance, laboratory diagnosis, and rapid response to measles cases, including the implementation of rapid vaccination strategies to stop chains of transmission. I will now continue in Spanish. Como mencionei antes, não é a primeira vez que enfrentamos esse desafio. Em 2018 e 2019, Venezuela
As I said before, this is not the first time we have faced this situation. In 2018 and 2019, Venezuela and Brazil temporarily lost their elimination status after major outbreaks. Thanks to coordinated actions from government, civil society, and regional cooperation, those outbreaks were contained and the region of the Americas regained its measles-free status in 2024. Today, we have more experience and better tools. If we act quickly and in a coordinated manner, we will be able to achieve elimination once again. In 2024, the regional average coverage of the second dose of the measles vaccine was 79%. If we compare it to 23 and 24, it's an increase and an improvement. But I want to be clear, a 79% coverage will not stop the next outbreak or adequately protect our children, families, and communities. We must achieve and maintain a coverage of 95% or more with both doses of the vaccine, especially in municipalities and communities where the virus can be spread easily. To achieve this, we must identify and overcome the barriers that prevent access to vaccines, understand local realities, and apply solutions that often require creativity and innovation. This means working hand in hand with communities and their leaders, involving all sectors that can help expand vaccination coverage and ensuring that vaccines are available at times and days that facilitate that parents can go with their children to get vaccinated. Eliminated the endemic transmission of measles has never been easy, but it remains one of the greatest public health achievements of our region. Because many other regions of the world have not achieved this, an achievement that we can and must recover thanks to vaccination against this virus. More than 6 million deaths have been prevented in the Americas over the past 25 years. And this is a great achievement. Every case we prevent, every outbreak we manage to stop, saves lives, protects families, and strengthens communities. Today, more than regretting the loss of a regional status, we call on all countries to redouble efforts, strengthen vaccination, surveillance, and timely response to suspected cases that are imported, which come in every week, and that all these activities are able to reach all corners of the Americas. As a region, we have eliminated measles twice. We can do it a third time, and PAHO will work even more so with the countries, all the countries in the region to achieve this. The history of public health in the Americas has always been a history of resilience. And today, once again, we must demonstrate that cooperation, solidarity, and science are stronger than any virus, because when we work all together, we protect the health and the life of all people in our region. Thank you very much. Thank you, Dr. Barbosa. Now we're going to start with the questions from the journalists. We have received some questions by email, and we also have questions on the Q&A. Thank you for your questions and giving us the outlet. From the Canadian press, we have Hannah, who Hannah will try to ask the question directly in English.
Hannah Alberga, the Canadian Press. Thank you. So you mentioned that Canada losing its measles elimination status means that the whole region loses it as well. But if Brazil and Venezuela only regains their status a year or two ago, does that mean that the region has only really had this status over the last couple of years?
Thank you, Hannah. Dr. Barbosa, you want to start?
Yes, thank you, Hannah. I think that it's very important to first to clarify the status. We can only say that as a region, we are measles-free if the 35 countries plus the territories that you have in the region have stopped the transmission. So if only one country in our region loses the status, the region, as a region, of course, loses the status together with the country. But all the other 34 countries, they are still measles-free. Of course, that to keep this status, they needed to interrupt any transmission before this deadline of 12 months. Because the criteria for the elimination is this one, is this. As I mentioned before, just to clarify, you can have imported cases, you are still keeping your certificate as measles-free. You can have a transmission for 1 month, 2 months, and you are still keeping your condition. But if the country cannot interrupt the sustained transmission by the same virus strain for 12 months, this country will lose the certificate. This happened with Canada, and of course, we are monitoring all the other countries, working with them to strengthen immunization coverage, surveillance, rapid response, because it's important that all the other 34 countries remain as measles-free, and we will work with Canada. And if Canada interrupts the outbreak and keeps the country free for another 12 months, and also accomplish with the criteria for immunization coverage, surveillance, and rapid response, Canada will receive again the certificate of measles. Thank you.
And just one follow-up question for you. What other countries are at risk of losing their status that you're monitoring?
Anna, I hope that no other country will lose their status. We are working with all of them. But of course, the situation in the countries we are concerned because we are receiving imported cases from Europe, from Asia, from Africa. So we need to keep the immunization coverage very high. At this moment, we have some countries that have outbreaks. We are supporting them. And our expectation is that they can succeed and can stop the transmission before the deadline of 12 months. So at this moment, I will not tell you no country. We hope and we are working very hard, not only hoping, but we are working and supporting them to stop the transmission. So we will keep all the other 34 countries measles-free, and we will work with Canadian authorities to regain their certificate, that this will also bring the region again as a region measles-free. Thank you.
Thank you, Dr. Barbosa. Vamos a continuar con preguntas de Canadá. Alana Smith del Globe and Mail envió por correo sus preguntas. En inglés dice, given that Canada
Now
has
in
lost
English, given that
its measles elimination status, what corrective measures have been applied to Canada to regain its status? How long typically does it take for a country to regain status? Dr. Salas?
Yeah, thank you for the question, Alana. And it is important. I'm going to start by the last question. Once that a country loses the verification status, it takes 1 year after that change of the status for the country to regain that status again. Of course, if that country present a corrective plan, many of the indications for all the countries that have lost the status goes to strengthen immunization coverage, but not just at the national level, as Dr. Barbosa was mentioning in his opening remarks. We need to have homogeneity. I mean, more than 80% of all the municipalities internally should have that 95% of coverage for the 2 doses of the schedule. In the case of Canada, it is important to finish the implementation of the immunization electronic system that they have been implemented. Starvax, it's the name. They have implemented that for 6 provinces. And one of the recommendations is to finish the implementation in the other 2 provinces that are remaining to have that. And of course, to present the corrective plan, to continue addressing the close-knit communities that have been reluctant or have hesitancy to accept vaccination. And actually, Canada has been like trying how to, have this community approach to understand how to break, the barrier, to understand the perceptions, to have the community leaders engage in all of this, so that even it might serve to other countries that have this kind of close-knit communities that are reluctant to vaccinate and actually like learn from that experience, for other countries as well. But those are like the most important remarks. Actually, Canada has, been doing a lot of good and important things. And those are like the main recommendations the RBC raised last week.
Gracias, Dr. Salas. Tenemos también Luke
Thank you,
Taylor
Dr.
from
Salas. We
British
have a
Medical
Luke
Journal.
Failer from British Medical Journal.
I'll try to give you the floor.
Luke.
If you want to make your question live, go ahead.
Hi guys, I've got 2 questions for you on this. You mentioned that there have been recent outbreaks of measles in the Americas that led to the region losing its measles-free certification. How would you compare this current outbreak or series of outbreaks to the recent ones? What is there anything that distinguishes it from the recent outbreaks when the region lost its certification? And also, we're seeing a rise in measles cases, not just in the Americas, but globally. Is it just a case of waning childhood immunization and the rise of vaccine skepticism due to circular growing misinformation, or is it a lot more complex than that? Are there other factors that are driving this?
Thank you, Luke. Dr. Salas, do you want to start or Dr. Seeley?
Thank you. Good morning. I can start. Thank you for the questions. You asked about when the region lost its measles certification some years ago, if there's any difference. The 2 countries were involved at that time. It was the same thing. The validation committee would have checked their status, checked to see whether or not there was ongoing cases for 12 months, and that would have led to same criteria that would have been used in this instance for Canada would have been used those years ago when that would have happened. And it's basically the same action plan that we would that Dr. Barbosa would have mentioned for Canada. We would have to make sure they have an action plan, make sure they have 95% coverage of at least of 2 doses of the vaccine, that they have rapid response, good surveillance, good laboratory network, so that they can detect cases early. So not much difference, and not much different in terms of what would have to be done for us as a region to regain our status. Daniel, I don't know if you want to take the second part of the question.
Yeah, sure. Regarding the waning immunity, it is important to note that if a person, I mean, if a child received the 2 doses of the measles containing vaccine, then the immunity is going to be the seroconversion, which is actually the number of antibodies, the titer of antibodies that that person is going to elicit against measles is going to be very high and is considered to be lifelong protective. Of course, there could be some cases that there is a compromise in the immunity system that may lead to a decrease in the titers of antibodies, but we consider that the immune memory that the 2 doses have developed in that person is going to act in the moment that the person is in contact with the virus. If you have just 1 dose received, then the possibility of a waning immunity, that could be something more important to consider. And the seroconversion is less. I mean, it's usually from 93% to 95%. So definitely you need to have strong coverage at the community level, not just at the national level, 95% for both doses. And important always to have that complementary measures of having surveillance in that sector, because of course there could be like important buckets of people that have not been vaccinated. But if you have a very acute, sensible system of surveillance that can detect timely all the cases, suspected cases, and a rapid response within the next 48 hours, you're going to probably stop most of the outbreaks possible that you might see arising in a country.
I'll just to add, because this is a very good question, Luke. Yeah, what are the reasons? I think that we are dealing with several relevant things that we need to address at the country level. I think that first, it is important to recognize that nowadays, the health workers, they needed to have all the information to provide the information about why the families needed to still get vaccines against a disease that they haven't seen a case in many decades or years in their communities. They needed to translate all the scientific knowledge that they have to the families, so they can be informed about why they need to get the vaccines and about the safety and the efficacy of the vaccines. But at the same time, it's important to recognize that all the services need to be well organized in order to reduce the barriers that some families have to access the vaccines. Even if the vaccine is in the health center, is free, but the health center is open only Monday to Friday, 9 to 5. 50% of the families in Latin America that work in an informal economy, probably this is a barrier, because if they are not going to work one day, they will not have income that day. So health centers need to be open weekends. The national authorities, the municipalities, the states, they need to have better information to identify where are the unvaccinated. So they need to develop specific strategies. And they need to guarantee that when the family goes to a health center, the vaccines are there, are available, and the health professionals also are there. We have several information from different countries in the region telling us that probably these two dimensions need to be addressed. First, information, good information, transparency based on the science, to address the doubts, the questions. We need to listen what are the questions that the families have about vaccines, but at the same time, we need to provide a better organization for the health service to reduce the barriers and to guarantee that they will have easy access to get the vaccines that they need for their children. Thank you.
Thank you, Dr. Barbosa. We are receiving many questions in the Q&A, but also we have some people asking for the floor. So Gabriel Emanuel I'm going to give you the floor. Please, if you can introduce yourself and make your question. Thank you.
Hi, thank you very much. I appreciate you doing this. I had two quick questions. I wanted to update on the US status and how close the US is to potentially losing its elimination status. And second, I wanted to see if you could speak a little bit more specifically about what the other countries that lost their status did to regain it. Thank you very much.
Thank you, Gabriel. Dr. Salas, do you want to start?
Yeah, sure. Thank you. Actually, yeah, the US is having some active outbreaks. They managed to close the outbreaks that they presented in New Mexico and Texas, but they're reporting cases recently in the last weeks in Utah, in Arizona, and South Carolina. And of course, I mean, we are supporting all the actions that the US has been taking to actually control the outbreaks, to stop them. It is important to continue the assessment. They started to present cases in January 2025. But I mean, as Dr. Jarbas Barbosa mentioned, we are really encouraging and hoping that they are going to be able to stop the transmission due to the same strain before that January comes. But it is important that, you know, for the classification of the outbreak, they need to have epidemiological research on the field to try to have very clear if there is a link between the different states outbreaks that they have been presenting. But I mean, we're hoping that U.S. is going to be able to stop the transmission as they did in the past. Actually, there was a moment not very far away where the U.S. were like on the limit of having those 12 months, but they managed to stop the outbreak. So that's something that we are counting on the U.S. to, you know, achieve to sustain the elimination.
Gracias, Dr. Salas. También tenemos a Debbie Shastri.
Thank you very much. We have Debbie Shastri from AP. Debbie?
Hi, thank you so much, Devi Shastri from the AP. I'm wondering if you could also tell us a little bit about what you're seeing in Mexico.
Yeah,
Thank
and
you.
yeah,
Sí,
sure.
doctor.
Yeah, Mexico is still presenting outbreaks. Chihuahua was the one, or the state, that has presented the most of the cases. And now there's been a report or the activity has been like migrated to some of the more center or south states in Mexico, such as Jalisco, Guerrero. So definitely they need to continue vaccinating and having the stratified strategies depending on the state, because not all states are the same. One of the things that the RVC has recommended to Mexico is actually to have a strong program of vaccinating these people, these workers that are migrating from, you know, because of seasonality from one state to the other, and try to vaccinate them first to have a strong, you know, vaccination coverage in those sectors. But of course, to strengthen the surveillance, as I was mentioning, if you have this kind of important surveillance system that can detect any suspected case and have a rapid response, I mean, the measles situation is not going to spread to other states. But definitely, I mean, Mexico is making important efforts to control the outbreak. They're going to have a follow-up campaign in April 2026. But one of the recommendations that the RVC has given to them is not, of course, waiting for that to, you know, the implementation of that campaign, but to act now, to have the enough vaccines, to deploy all the teams. PAHO has been training a lot, you know, in terms of rapid response, in terms of how to improve surveillance. And actually this week, we're having a mission there to Chihuahua so that we can support, you know, people from PAHO, from the regional level, to give some double down on the support that we have given to Mexico to try to detect exactly what are the opportunities of improvement in that country.
Let me just add one thing, because there is from Sandra Moreno, hay una pregunta: México ha perdido su certificación, y ahí aprovecho.
Mexico
No.
has lost its certification. The answer is no. Just to clarify, the Commission verified Canadian data, presented the recommendation that we accepted and reviewed, that Canada will lose its certification because Canada has shown 12 months of sustained transmission of the same measles virus. So that is for Canada. As to the other countries in the region, they continue to be certified, and safe. And for Mexico and the US, we are supporting, as Daniel just mentioned, in the case of Mexico, we are putting vaccines, making them available, putting them at their disposal. We're also strengthening laboratory surveillance. We're also training vaccinators. We are also working with the health secretariat and also with the communities. We're implementing all of the effort for Mexico to interrupt transmission before 12 months of sustained transmission. If they attain this, they will not lose their certification. Canada lost it, and since one country of the Americas lost it, the region as such is not free of measles, but the other 34 countries continue to be certified. I thank you, Dr. Barbosa, for the clarification. I just want to repeat a part of the question by Gabriel Emanuel from APR and in English.
That lost the status before did to recover the measles-free status, Dr. Salas?
Yeah, thank you for that question. In the case of Brazil, they implemented a strong program on microplanning. The microplanning is a strategy that allows countries to thoroughly identify exactly where are the unvaccinated children, how the strategies on the field should be targeted or should be addressing those buckets of unvaccinated. And it's very powerful. Actually, it made a huge difference in what Brazil was doing in the past. And it's not that microplanning has not been implemented in the past, but it is important to actually check if countries are really implementing it well and implementing it widely in all the subnational levels. Of course, strengthen surveillance and have a strong communication strategy, and networks in identifying influencers, positive influencers that can help, for example, in the moment that there is a fake news or something that might, raise panic in the population. They manage that very well. They also worked with the Congress, and I mean they had like this kind of joint a strategy with all the different social actors and the departments there to face the situation, and they managed to actually stop the outbreaks and improve that all these strategies all together were strong enough. In the case of Venezuela, for example, they had like for almost 3 years a very, very aggressive, active search of cases throughout all the country, even though coverages were not like at the best possible level, but that strong and continuous looking for cases. I mean, it was very, very well deployed and very well implemented that actually led Venezuela to recover that status. Thank you.
If I could just add, Sebastian, just to summarize what Daniel said, for a good response and for countries to regain the vaccination status, they need to have good vaccination coverage and using tools, Daniel said about like microplanning, and as Dr. Barbosa mentioned, making vaccines more accessible to persons. Secondly, they need to have good detection. They need to be able to detect cases rapidly and have good response, so good surveillance. And what we mean by that, their ability to detect cases early. For example, to be able to find cases of fever and rash, because those are the signs of and symptoms of measles. If you detect that early and you have a response and you can confirm, you will be able to contain the cases. And once you have that containment and no cases for 12 months, then you would be able to regain the certification. So good vaccination, early detection through surveillance, and a rapid response.
Yeah.
Thank you, Dr. Seeley. We have in the chat a question from Bishosa Isai from the New York Times. Asks, are you concerned about the resurgence of other diseases like mumps and rubella in Canada? Who wants to take this?
Well, we haven't had any news about a resurgence of rubella specifically. Measles, of course, it has been there, and it is because mainly to being the most contagious virus in the world, as we have been mentioning before. But I mean, of course, that's why we're having these communication, because the Americas lost the status, because Canada lost the status, because we act as a bloc differently from other regions that have not achieved this kind of elimination status. But the resurgence could happen everywhere, and especially if there are no strong vaccination coverage, if there are no good surveillance systems, if the teams that should be deployed very timely, very rapid, when there is a detection of a suspected case, that doesn't happen. I mean, those are like the main factors that are of concern actually, and that we need to continue working with, with countries to strengthen those three pillars that can sustain or can bring us the recovery of the status again, the regaining of the status again.
Thank you, Dr. Salas. Tenemos también a Carmen Pound.
We also have Carmen Pound. She would like to ask a question live.
Thank you so much, Sebastian. This is Carmen Pong from Politico. I was wondering, do you have any data? Can you tell in any way whether there has been a connection between the outbreak in Canada and the US, or between the outbreak in Mexico and the United States? Are there sort of like any connection between these outbreaks, or were they sort of like separately seeded by imported cases from other regions? And the second one, would you say that basically what has happened in Canada and what could happen in other countries in the region is that the vaccination coverage was just not high enough to protect from the virus becoming endemic again? Sort of like, I understand that there are imported cases, but how come, it led to sustained transmission for 12 months? Is it because of the low vaccination status? Thank you.
Thank you, Carmen.
Yeah. Well, yeah. Thank you. Thank you for your question, Carmen. Actually, the situation in Canada has been mainly focused on this kind of tightly close communities. It's not for the general population. There's no spillover for the general population. Canada has managed to have like good levels of coverage, during the last years. But it turns out that they have these important numbers of these members of these close-knit communities that has sustained somehow, the transmission throughout all this year. So it is not like that. It's not that impact for the general population in the case of Canada. And of course, a number of susceptibles, which are the people that are not immunized, probably they're getting to an end in these close communities that are usually not like very willing to receive vaccines. That's why the government and the provinces has been working to try to, have a strategy, a tailored strategy to have a better approach to this kind of communities, and to convince them the importance of not just receiving the vaccines, but actually, for example, not traveling if they're presenting symptoms of measles, and declaring that they are having symptoms to the authorities, the health authorities, to try to sustain or to avoid any kind of spreading of the virus. And regarding if there is a link between or among the outbreaks in the Canada, US, and Mexico, yeah, there was a link, and it was mainly because of these close knit communities that they move, they travel. But that could have happened, even with imported cases from other regions, as Dr. Barbosa was mentioning. We represent this year 7.6% of all the global cases of measles. So the intensity of transmission is not in the Americas, even though we are losing the status. The intensity of transmission is everywhere else in the world, and we can have importations anytime if we don't have this level of coverage strong enough, and the surveillance and the rapid response. So those are the factors. There is a link in this case, but I mean, it could have happened the same with importations from, different sources anytime, and can happen eventually in other countries anytime because of this intense activity of measles in the rest of the world.
Thank you, Dr. Salas. We have a question from Germain Abel from St. Kitts Vibes. He says, can you speak to the Caribbean region's vaccinations efforts? He says, especially for St. Kitts and Nevis. He says there were some concerns that the vaccination rates, especially for the second dose, remains low. Are you concerned? And with the winter season upcoming, what are the recommendations from PAHO as travel will increase? Dr. Seeley?
Thank you. So we seek to get 95% coverage for both first and second doses. It's a challenge sometimes to get that coverage for the second dose. For the Caribbean in general, the Caribbean does have good vaccination rates. We do see decline from time to time. You mentioned the upcoming winter season. Yes, we are concerned about diseases that can be transmitted via the respiratory tract, via respiratory secretions, and measles is one of those. So of course we are concerned. So we encourage countries to get the vaccination coverage to at least 95%. We also encourage persons to report cases of fever and rash as soon as possible, and as Dr. Salas would have mentioned, to not travel when they do have symptoms of fever and rash so that we can avoid the spread of the disease. But vaccination coverage in the Caribbean has been very good, and we have been seeing gains and improvements over the last few years.
Thank you, Dr. Seeley. En el chat tenemos
Thank you,
una
Dr.
pregunta de
Seeley.
Elena
We have a
San
question
José
in
de
the
El
chat
País.
from Elena
Dice,
San
¿cómo
Jose,
valoraría
El
la situación
País.
actual de
How
México?
would you assess the
Hace
current
un mes se produjo
situation
la
in
última
Mexico? A
muerte por la
month ago,
enfermedad
we
y
had
sigue
the
habiendo casos
last
nuevos confirmados
death
cada
due
día,
to the disease. We have
especialmente
new
en
confirmed
Chihuahua,
cases every
donde
day,
se
in
da el
particular
brote
in
más
Chihuahua,
fuerte.
where we
¿Está
have the
pasando
strongest
algo o ya
outbreak.
se está
Is
haciendo todo
anything
lo que se puede?
failing, or are
Dr.
you
Salas?
doing, or is everything being
Sí,
done
gracias,
that could be
Sebastián,
done?
y gracias por la
Dr.
pregunta.
Salas, thank
Lo
you,
que veníamos
Sebastian,
comentando,
and I
México
thank you for
viene
the question. As we said
trabajando a
before,
nivel de los
Mexico is
diferentes
working
estados con el apoyo de
in the
OPS
various
para
states with
mejorar las
PAHO
estrategias de
support to
vacunación.
improve the
Es importante y
vaccination
parte de las
strategies. It
recomendaciones
is
que le ha dado
important
la
as part of
RBC
the
es
recommendations
focalizar los
by
esfuerzos
the
y
RBC is to
el traslado
focus
de vacunas
the
hacia donde
efforts
más se
and
necesitan
also the
y también tener esa
deployment of
posibilidad
vaccines
de
where they are needed
vacunar
the
también
most, and
a
also to
las
have the ability
personas,
to
a los
vaccinate
trabajadores que se mueven por situaciones
workers
de
who migrate from
estacionalidad, de
one area
trabajos que
to the other
surgen
because
en
of the
algunos momentos del año,
seasonality and
pero que
also
también
because
obviamente
of
si no
some work
están
that
bien
may come up
vacunados
throughout the
o no
year.
están
But
vacunados
if
del
they are
todo,
not
pueden
properly
transmitir o llevar el
vaccinated, or if
virus
they
de
are
un estado, una comunidad a
or they
otra.
have
Entonces, eso ha sido una
incomplete
de las principales
vaccination,
también
they can take the
recomendaciones que se le ha
virus
dado a
from one
México. Como
state
yo
to the other
mencionaba,
one. That has been the main
México también tiene que
recommendation
mejorar
shared
obviamente
with
sus coberturas de
Mexico, and
vacunación.
clearly
Hace
Mexico
como
has to
unos 4
improve
o 5 años
their
habían hecho una
vaccination
campaña de
coverages.
vacunación contra
4 or
sarampión
5 years
que
ago,
fue
they
muy
had a
exitosa.
measles
Sin
vaccination
embargo, es
campaign
importante
that
seguir
was
trabajando con
highly
la
successful,
vacunación de
but we
rutina,
need to
para lo
continue
cual
to
también
work with
OPS ha estado
routine
tratando de
schedules,
ayudar al país,
systematic schedules of
implementar, por ejemplo, la
vaccinations, and PAHO has been
microplanificación
working
y
with the
tratar
country,
de
for example, in the
pues tener
implementation of
esa
micro-planning, and also
comunicación oportuna entre los
having
diferentes estados.
timely
También cuando hay un
communication
brote,
within
que
the
se hagan
states
todas
whenever
las
there is an
contenciones en el
outbreak.
momento,
All of the
no esperar,
containment
¿verdad?, que
has
el
to
brote siga
happen
avanzando
timely
para tomar las
and
acciones. Esa
prevent
rápida
any spread of
respuesta hace
the
una enorme
transmission.
diferencia
So
entre
that
que México pues
timely
pueda
response
justamente
has
recuperar su
made a
estatus, o
great
más bien recuperar, no,
difference
mantener su
in
estatus en este
having
momento,
Mexico
que esperamos que lo
maintain
haga, como decía nuestro
the
director.
status, and we hope that that is the case, as our director
Gracias, Dr.
mentioned.
Salas.
Thank you, Dr. Salas.
Tenemos a Julie
We have
Steenhuisen.
Julie
Disculpa
Steenhuisen.
si digo mal su apellido,
I
de Reuters. Julie,
apologize
I'm gonna
for
give
the
you the floor to
mispronunciation,
ask
from
your
Reuters.
question. If you're listening, go ahead.
Can you hear me?
Yes.
To clarify some of the comments, I'm reporting out of the United States. We've been, having several outbreaks this year, and I need to sort of understand what exactly does the United States need to do to prevent losing measles elimination status? I mean, we had the large outbreak in Texas, but that has been, that has ended. But now we have cases in Utah, Arizona, and South Carolina. are those when you mentioned, Dr. Salas, epidemiologic coverage, and what are you saying that does the strain have to be the exact match of the strain that began in January for that to count as sustained circulation of the virus? I think this is a really important point for us to understand. Thank you.
Yeah, thank you for your question. Actually, as you was mentioning, the importance of having this link between the different outbreaks that the U.S. has been reporting, it's something that is key to actually know if we are talking about the same strain, the same chain of transmission, because measles, it mutates, but it doesn't mutate like so much that it can make, for example, vaccines not effective. Vaccines or measles vaccines doesn't need to be reformulated, because those mutations that can happen are usually small mutations. But of course, that laboratory information is going to be very important to have the link between the different outbreaks, but the epidemiological data is going to be important as well to have that link. And some of the recommendations that the RVC has given to the United States to, improve or to continue what they're doing well is to enhance the case investigation protocols to close those gaps in epidemiological data, including detailed travel history, contact tracing, implement complementary surveillance activities at the local level that may help close gaps in epidemiological data. Those are one of the most important things, to try to have this approach or have this determination if there is continuity in the different outbreaks that they have been experimenting. And of course, it is important to conduct a local level assessment as needed to identify the under-vaccinated communities and prioritize them for supplemental immunization activities. The strengthening of outreach and community engagement in tightly knit social networks through culturally tailored communication and trusted local partners is one of the other recommendations. We recognize that these close-knit communities that might have this reluctance to receive vaccines have represented an important challenge in all of these outbreaks that have been happening in the Americas this year. And of course, to have this documentation of the strategies that they are having implemented and show that to the RVC. But that's a follow-up situation that is going to happen in the next months with the RPC assessment, PAHO assessment, and all the things that are needed to understand the situation with the US in the following months.
Gracias, Dr. Salas. Creo que su
I
respuesta
thank
también
you,
sirve para
Dr.
responder
Salas,
a
and I
preguntas
think
que hemos
that your
recibido de
suggestion,
genéticas
your
sobre esta
answer
y del
also
Lina Sanz
addresses
Washington
some of the
Post.
questions that we
Cualquier cosa podemos darles
received
más
from the
información luego
Washington
por
Post and other
correo
journalists, and we can
también.
send them
Y
more
tenemos
information
preguntas
via
directas
email
de
if
varios
necessary, and we
países
have
que
different
preguntan
questions
por
from various
situación de
countries that
sarampión y
are asking
cobertura
about the
vacunal.
measles situation and
Que tenemos a
vaccination
Daniel Collins,
coverage.
de
We have
TN23 en
Daniel
Guatemala,
Collins
Violeta
about
Villar, de la Voz de
Guatemala,
la
Violeta
Salud en
Villar
Panamá,
from
de Perú
Panama,
21, de
Peru
Vilches, de Irene
21,
Hartman, de Clarín
Vilches, Irene
Argentina, también
Harman,
Chandris
also from
Santivia,
Argentina,
de Crónica
Chandris
1.
Santivia
En
from
general preguntan
Crónica
sobre la
1.
situación
So we are being
en
asked
estos
about the
países, Argentina,
situation in
Guatemala,
these
Perú,
countries, Argentina,
Panamá y
Guatemala,
Venezuela también, y
Peru,
recomendaciones
Panama,
en
and
algunos casos
also
teniendo en
what
cuenta bajas
recommendations, and
adherencias a la
also
vacuna.
bearing in mind the low vaccination coverage.
No sé, doctor Salas, si quiere comenzar.
Dr. Salas, I don't know if you'd like to start.
Bueno, yo creo que
Yes, I
la
think
importancia
that
aquí es
once again,
a todos los países alentarlos.
we need
Yo
to
creo que hay un
encourage
mensaje
the
muy importante que
countries
también el doctor
as
Barbosa
part of
mencionó al
this very
principio,
important message, as
porque
Dr.
el
Jarbas
compromiso
Barbosa mentioned
político,
at
la
the beginning, because the
sostenibilidad de los
political
programas de
commitment and also the
inmunización y de
sustainability of
vigilancia,
the
el
immunization and
adecuado
surveillance programs, as well
recurso
as
también
the
para tener los laboratorios
proper
funcionando y que
resources
puedan
to
tener un
have,
feedback, aunque no hace
include
falta tener una
labs
confirmación
that
del laboratorio
are
para actuar. Es muy
operational
importante
labs,
porque
even
hay
though we do
países
not need to have
o hay
lab
zonas en donde se
confirmation to
espera
act, because
que el
in some
laboratorio diga
countries
si
there or
verdaderamente se
some
trató
areas
de
are
un
waiting
caso de
for the lab
sarampión
to confirm
y si se
whether it
espera
was
a
a
que haya esa
measles
confirmación
case or
para
not.
actuar
And
ya
if
es
we
muy
wait
tarde.
for
Hay
that
que actuar siempre
confirmation, it is
basado
too
en un
late.
sistema de
We
vigilancia
always need
epidemiológica.
to
Casos
act based on
sospechosos,
the epidemiological
rápidamente
surveillance
buscar
system,
cuáles son los
suspected
contactos de esos
cases,
casos,
try to
ver cómo
identify
está su estado
trace
vacunal,
contacts, and
actuar
also try to
vacunándose
determine
si
the
uno
vaccination status by vaccinating. If we can vaccinate within the first 48 to 72 hours, even if the person does not have a full schedule, that could also help for the virus not to be transmitted, communicated, and we are reducing the transmission. So all of the countries have different challenges, and that's the reason why the RVC receives all of the reports presented by the countries on an yearly basis, and also by following the work framework set up by PAHO for everything that is measles related. And then the regional commission analyzes each case and presents specific recommendations. And finally, Dr. Barbosa, the director of PAHO, reiterates this and shares this with each of the countries. But it is important for the countries to remain open to receive these recommendations. We saw this done last week at the level of the national committees, at the national commissions, but it is also important to make the adjustments to the measures, because once again, a country may have a 90% coverage that continues to be insufficient. But if we look into the country, we will see municipalities and districts that have very low coverage, 70 or 80%, and then the risk of an outbreak is higher. So far from just referring to one country or the other one, we need to understand the context, the strengths of the country, whether it is a country that has identified these close-knit communities that might have closed doors to vaccination and they are unwilling to receive vaccination. So we need to start working with these communities to convince them that they need to go beyond their closely knit communities to receive vaccination to strengthen herd immunity, and that is what allows us to prevent the reinstatement of measles in our region and in our countries. Just to add to the answer to this question, it is important to share with you PAHO's dashboard that includes all of the information that we received from the countries on vaccination coverage, not only nationally, but also subnationally. And as we mentioned it more than once, is that the biggest problem for the transmission of measles is not to attain the proper vaccination coverage. As I said it at the beginning, the measles virus is the strongest one, the one that is the easiest to attain transmission. So if we have a traveler that has measles and we have, for example, that situation throughout the Americas, if that person gets to an area where there is 97% vaccination coverage with the second dose, the risk for this person to be able to communicate this virus to someone else is zero. But if that person gets to an area where vaccination coverage is only 70%, 80%, that person will be in contact with unvaccinated individuals who may get the virus. So that is where we have the beginning of transmission. So the only way to avoid transmission is to attain at least 95% vaccination coverage with the second dose, that is to say with 2 doses in each of the communities, not only as an average, but we need to have as a homogeneous vaccination coverage, as our head of immunization just mentioned, in each neighborhood, district, municipality, town, because this is the only way that we can guarantee the non-transmission of the virus. It is a challenge because the homogeneous coverage of the population with 2 doses at 95% level is a challenge for any country, but I think that with the commitment, the history of our region, the efforts, and also what we have seen with other diseases that have already been eliminated, we were the first region in the world to eliminate rubella and polio. So we continue to be free of rubella and the congenital rubella syndrome, but the verification of elimination is individual for each disease. So what we are discussing here today has to do with the certification for measles, and also the criteria for the other diseases are specific. And at this point in time, there is no other country in the region that has lost its certification as free of rubella or the congenital
Gracias,
rubella
Dr.
syndrome.
Barbosa.
I thank
We
you.
have
Thank you,
Helen
Dr.
Bransford, who
Barbosa.
would like to make a question live. Helen, I'm going to give you the floor. Go ahead.
Thank you very much. I'm Helen Branswell. I'm a reporter with STAT. I just want to get Dr. Salas to clarify some comments he made both to the NPR reporter and to the Reuters reporter. You said that the outbreak in the United States in West Texas and in New Mexico had stopped, but then you raise the possibility, I think, that some cases elsewhere in the country may be linked to that. Is there evidence that there is ongoing transmission from that outbreak, or are you just saying that in order for the country to hold on to its elimination status, it's going to have to prove by, analysis of the viruses that other cases elsewhere were not triggered by that transmission chain? Thank you.
Yeah, thank you, Helen. And you double down on the importance of having this epidemiological link between outbreaks. It's not just enough to have laboratory reports, but because, of course, as I was mentioning, the movement of people is happening everywhere, and in a country with as big as the United States, even there could be, of course, more importations. There could be this transmission, and among states. And if you lose this link, if you don't have that epidemiological data, detailed travel history, contact tracing, that level of detail to actually prove, of course, there's going to be doubts if it's about the same chain of transmission or not. And that's something that, of course, country need to show the evidence that, it could play in favor, it can play con of sustaining the transmission, but that's something that RBC will need to assess at the moment, that 1 year of eventual transmission is going to happen. That, of course, we are hoping that the US is going to stop the transmission even before that deadline. But yeah, the epidemiological data is going to be always important and really key to have that kind of detailed information that can bring the assurance to countries and to the region that is not about the same, chain of transmission, or if it's the opposite.
Gracias, doctor Salas. Tenemos algunas preguntas más. Ya estamos en el.
Thank you, Dr. Salas. We have a few more questions. We're getting ready to wrap up. However, from Costa Rica, we have a question. What are the recommendations for the countries who have high vaccination coverage and no outbreaks? Is there a special recommendation also for those people traveling to Canada? Vaccination, as we said, and if you have high sustained coverages, this is very important in and of itself. But I was also talking about stratification. See the subnational levels, because many times there are communities or areas that for a year have maintained low coverages. So you shouldn't trust the overall nationwide average. No, Dr. Barbosa said that you have to stratify, do risk analysis, do interventions, and listen to the people. What are people saying of why they are not having access to the vaccines? Are they hesitant? Or, as Dr. Jarbas was saying, we need to also continue to train health workers so that they are able to convince the people of the importance of vaccinating against a disease they're not seeing, but eventually, if it happens, it can lead to many complications, serious ones, and even death, and complications like with, for example, encephalitis, that where the virus can be dormant in the nervous system, and then it wakes up at some point in time, and then it can lead to terrible encephalitis that can be potentially deadly. So we need to have several components, an adequate surveillance system. It is expected that countries are reported per 100,000 inhabitants, at least two suspicious measles cases per 100,000 inhabitants. So this level of surveillance should be maintained. And this is the minimum, but also do research on the cases within the first 48 hours that the lab samples can be obtained and manipulated or handled in a few days. These are all parameters that countries need to be taking care of so that they have a robust, not only vaccination, immunization program, but also surveillance program that the healthcare workers are duly trained and can educate the patients. And traceability of contacts is so important. A contact that has already acquired the virus, people with measles are going to start transmitting the virus 4 days before they have the rash on the skin. So the likelihood of following the tracing contacts that they say if they have a fever, if they have coryza, conjunctivitis, the rash, the coughing, all these early signs that are clear signs of measles. And these are also important things in countries that have high coverages to have to work on the three components. And just to supplement Dr. Salas's comments, also the recommendation for those traveling to Canada. But no, if you're traveling to Japan, from France, Germany, you have to have your vaccinations updated. It is very important that when we take a look at the data of the region, the cases that are received here in the region are countries who belong to the region who traveled for tourism or business to Asia. They were not vaccinated, and they come back to their countries with the infection. So it's important to protect their family, to be updated on their vaccine schedules, because a person may not travel, but maybe the neighbor or a co-worker travel. So it's not a problem of when you're going to travel or where you're going to travel. It's a problem or an issue of having your vaccine schedule updated. You can be in a restaurant, in a hotel, in a meeting. You always need to be well protected. Thank you, Dr. Barbosa. I remind you all that we have shared in the chat the dashboard with the status of the countries, because there are very specific countries about specific questions about specific countries, and so you can take a look at the dashboard. But let me clarify, this is a dashboard not only for measles but other vaccines, and this is the information that the countries report back to us with immunization coverage, etc. Thank you for the clarification. I would like to give it over to Dr. Barbosa in case he wants to give a few final words. Thank you, Sebastian. First of all, I would like to thank those who were here today. This has been a brief summary. It's important to first remember that the region of the Americas is still the leader, the global leader in prevention and elimination of diseases. We are the region in the world which more quickly are recovering from the negative impacts of the pandemic and also in vaccination against measles and other diseases. So for 2 years, PAHO is the region that recovers most quickly, but we need to continue to work on the vaccine coverage that is necessary as in the case of measles, since it's the most contagious virus that we know of, we need to have 95% coverage for 2 doses, and it needs to be homogeneous throughout the cities, municipalities, blocks, city blocks, sub-region, etc. There's always a risk that someone who has traveled back and forth or a traveler coming to the country, if they are not duly vaccinated, they can bring the virus. So the United States, Venezuela, Brazil, the United States was able to break that transmission before having continuous endemic transmission for 12 months with the same virus, the same strain. If the virus that is the same, it is the same, if it's from Asia, from Africa, whatever, we have conditions to identify. So the United States, at that point in time when they were almost about to lose it, they were able to interrupt it. Brazil and Venezuela were not able to interrupt the transmission. So Brazil and Venezuela lost their status of being free of measles. And that's why the region lost regional status. However, all the other countries keep their own. We are working with from PAHO, where we worked with Venezuela, and Venezuela, despite of all their difficulties at that point in time, they were able to vaccinate 8 million people, 8 million children. Brazil and Venezuela were recertified as free of measles. Now we have the situation where Canada lost their status and certification of being free of measles. And the reason, let me explain once more, for a period of 12 months, Canada was unable to stop endemic transmission. When one single country loses that status, the whole region loses it. However, all the rest of the 34 countries in the region continue to have a condition which is free of measles, but we need to continue to work with all countries, all those countries that are experiencing outbreaks, so that they can stop transmission before the 12 months transmission. We have 3 key things: vaccination, 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 with appropriate coverage over 95%, 2 doses over 95%, and also having strong monitoring and surveillance to check cases that are coming from other countries. So maybe other countries don't have sensitive surveillance to detect. So we need to have very sensitive surveillance to quickly identify when cases arrive in the country, and also rapid response when imported cases are identified to prevent these cases to start transmitting and establishing a transmission chain that eventually will make it very hard to control an outbreak. As we've said before, measles is a very contagious, the most contagious virus known to man. And so this is a terrible challenge in any country of the world. So it is important to have a triple action: high coverage, over 95%, ability to have rapid response when you identify a case, and we are going to continue to support the countries in the region through the revolving funds. We have access to the vaccines against measles, and this is important to know, and we need to continue making efforts so that we can prevent any more problems, and we will continue to identify all these situations. And thank you very much for being here. Thank you, Dr. Barbosa. Thank you, Dr. Salas, Dr. Seeley, Thomas, for having answered all the questions. And please continue to send your questions. You can email us, and we will be answering directly all your questions. Thank you very much for being